Thank you, Chairman Hill. We have another amendment. It is amendment number 2. Chairman Jernigan, you are recognized, sir.
Thank you, Chairman.
Is that drafting code 005080?
I think it made me look.
Uh-huh. Okay, Chairman Jernigan.
Yes, sir. Take it from the Hill from Washington.
Chairman Jernigan, you recognize. We have a motion properly second. Chairman.
Thank you, Chairman. I appreciate the opportunity to speak. This amendment is about pre-existing conditions, which obviously is, well, it's very important to me. A district court in Texas has ruled that the ACA is unconstitutional, which includes pre-existing conditions. Tennessee has joined in on this lawsuit, and my fear is if the U.S. Supreme Court overturns the ACA, then Tennesseans will lose coverage due to pre-existing conditions. I understand the sponsor wants to keep the language in the bill vague in order to negotiate, and I understand that, but this may be the only opportunity that I may have, and all Tennesseans with pre-existing conditions, that may have to ensure those of us with pre-existing conditions are taken care of and not discriminated against due to a pre-existing condition. This amendment will specifically address, when negotiating for a block waiver, that pre-existing conditions will not be eliminated in any block grant awarded. Further, the Attorney General and reporter will take no action to eliminate, reduce, or impair existing federal or state laws to prohibit discrimination by insurers on the basis of pre-existing conditions, their health history, or their gender concerning the health insurance. And last, as mentioned earlier, I humbly ask that Tennessee withdraw from the lawsuit in Texas versus the United States to ensure our current right to be protected from simply having a pre-existing condition by no fault of my own or others. Mr. Chairman, I move approval of the amendment.
Thank you, Mr. Chairman. Mr. Chairman, you recognize.
Thank you, Chairman, and I appreciate the intent by the sponsor of this amendment. Part of the reason that the legislation is drafted the way that it is to provide as much negotiating room for the governor and the commissioner of F&A as much as possible. And I'm concerned that we may be confusing the ACA with Medicaid funding, and I don't question the intent of the sponsor one bit. But in the interest of trying to keep this bill in its current integrity and with the same mission that it started out with, Mr. Chairman, I'm going to humbly just move this amendment to the table.
Thank you, Mr. Chairman. We have been moved to the table. We have a motion. That was a motion. Then we have a second. That will cut off all debates except sponsor of the amendment. Chairman Jernigan, anything to say?
Thank you, and I just would like to I guess stress to the sponsor. I hope that if this amendment is tabled, that you will consider pre-existing conditions when we negotiate, because I know you're confused with the ACA, and it's not my intent. It's just that the ACA is what covers pre-existing conditions for all of us. And this was an opportunity and a vehicle that I could attach my amendment on to ensure that this would happen. So I can't say anything. I just want you to know this comes from a genuine place in my heart. And Mr. Chairman, with all due respect, and so I will ask you not to table the amendment. Thank you.
Thank you, Mr. Chairman. Okay, now we're voting on the table amendment. Do we have a motion and a second? Oh, no. Yeah, we're voting on the table in motion from the Chairman Hill. All in favor of tabling the amendment, say aye. All opposed, no. The amendment will be tabled, sir. Our next amendment is Representative Thompson. You're recognized on 005048, correct?
Yes.
Thank you. You're recognized, sir.
Thank you, Mr. Chairman.
We have a motion, probably second.
This amendment is dealing with rural hospitals. As you know, Tennessee leads the nation in rural hospital closures over the last 8 years. We've had 13 closures, and we have others threatening as well. When a rural hospital closes, it causes a job loss that's equal to a factory closing. It demoralizes the county, it reduces healthy outcomes, endangers the population, increasing deaths and serious health outcomes, reduces the tax base of the county, which reduces school funding and other government services, reduces the chance of economic growth in the county. And how many companies want to increase jobs in the county with no hospital or reduced health care? The amendment's necessary for the stabilization of rural counties to allow them the opportunity to grow. And without it, wealth in Tennessee will continue to be concentrated in the urban and suburban counties, leaving the rest to languish.
Representative Hill, you're recognized, sir.
Thank you, Chairman. Again, just a word, not questioning necessarily the intent of what this amendment is. I represent a rural district and very honored to do so. I'm very proud to do so, and am very concerned about health care in the rural parts of the state. However, that being said, the intent and the purpose of this legislation, back to the original goal of this legislation, is to open up the discussion for block grants from the federal side of the funding of Medicaid. And if it's done properly and done right, and certainly with the approval of the legislature, that is exactly what needs to be done to make sure that our rural hospitals and rural care can exist and be sustainable. And so that's part of the reason why I'm bringing the bill in its original form. Mr. Chairman, again, with respect to the sponsor of the amendment, I move Amendment 5048 to the table.
Chairman Hill has made a motion to lay amendment on the table. Have a second, properly second. Cuts off the debate, except for the sponsor of the amendment. Representative Thompson.
Thank you, Mr. Chairman. The health of our citizens should not be a negotiating tool. It's essential for this state. It's essential for each of the 95 counties in this state, and we need to guarantee that healthy system, or a good healthcare system in each of our counties, each of our municipalities. This is essential for the not only because it's the right thing to do for our citizens, but it's also the practical thing. We are not going to advance economically in any part of our state that has no hospital, that has reduced health care. Therefore, I urge everyone to vote no on the tabling motion. Thank you.
Thank you, Representative. We are now voting on the table motion. All in favor of tabling, say aye. Opposed, no. Amendment will be tabled. Amendment number 4, Representative Miller, you are recognized on 005164.
Thank you, Mr. Chairman. Mr. Chairman, I would like to withdraw, motion just withdraw amendment number 1.
Motion 1 withdraw.
Thank you.
Representative Miller, you have another amendment 005165. You recognize, sir?
Thank you, Mr. Chairman. And
we have a motion, properly second.
This motion basically support the block grant, but this amendment changes it with this language. The new TennCare 2, waiver request for funding in the form of a block grant must also provide for the coverage of those persons who would have been covered by the TennCare Demonstration Amendment number 25. Mr. Chairman, may I request that the attorney of this committee that wrote the amendment explain briefly what that demonstration amendment number 25 is? Is that?
Yes, sir, we will. Thank you, Mr.
Thank you, Mr. Chairman.
Jamie.
Jamie Shanks, Office of Legal Services. It's my understanding that this population would be the ones referred to as newly eligibles between the ages of 1964 who are not otherwise eligible for Medicaid and have family incomes that do not exceed 138% of the federal poverty level.
And with this amendment,
Representative Miller.
Mr. Chairman, that would include covering at least 200,000 low-income Tennesseans that would not be covered currently under the representative's legislation. So basically, we want to cover an additional, as we negotiate, as the governor and the commissioner negotiate with Washington, that we want to at least have in that discussion the ability to cover and pay for 200,000 low-income Tennesseans. Mr. Chairman, may I request, if it's appropriate, that if it's anyone in the audience, if we could recess that could, for an example, if anyone representing a TennCare at this time could give us a better explanation of what impact my amendment would have on this bill.
Yes, Representative. Is there anyone in the audience would like to speak on this? Seeing none, let's get back on. Have we got someone? Okay. Oh, Ashley, would you like to come up and say something? Okay, we're going to go out of session and hear from TennCare.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. With this amendment, if there was an additional population to be covered than we currently cover, we would need additional dollars to do that.
Thank you, ma'am. Representative Miller.
Thank you, Mr. Chairman. I mentioned in my statements that there were 200,000 low-income Tennesseans currently. My question is that number accurate? I kind of think that it's probably more Tennesseans that are currently not covered under TennCare, understanding that basically it's covering children and pregnant women. So my question is, what is a truer number of uninsured and uncovered Tennesseans?
The University of Tennessee does an annual study that determines the number of uninsured persons in Tennessee. I'm happy to provide that. I think I've provided it to your office. That's the only estimate that we have. We don't have a current estimate of uninsured from TennCare.
And what is that estimate?
I don't have that data
you don't have
in
that
front of me. Yeah.
Currently. Mr. Chairman, that's the only questions I have.
Thank you, guys. Now we'll go back in session. Chairman Hill, you're recognized, sir.
Again, thank you, Chairman Travis. Numbers being thrown around, and again, the intent by the sponsor, I respect the intent by the sponsor. The original goal of the legislation, as the amendment sets forward, it is possible. There's negotiating room to try to use existing resources in a deal that would be good for the state of Tennessee to serve potentially some of that population, especially in conjunction with some of the work that's going on the TennCare Oversight Committee. It's possible. What this amendment would do, though, is it would hamstring the process, and it would hamstring the negotiations in pushing it into something that is not the original intent of the bill. And with respect to the sponsor, Mr. Chairman, I moved Amendment 5165 to the table.
Chairman Hill moves the amendment to the table, so it cuts off, we got a motion, we got a second. Cuts off the debate except for the sponsor of the amendment. Mr. Representative Miller, you're recognized.
Thank you, Mr. Chairman, and thank you to the sponsor. And as he mentioned, there are a number of numbers that are being thrown around. And going back to your original intent of this legislation, to go to Washington and negotiate for a set amount of dollars for the fact of coming back to ensure the health and the welfare of Tennesseans. My amendment simply says make that a part of your negotiations. Ask Washington for enough money to cover all of the Tennesseans that are not currently covered. And we're looking at 200,000 Tennesseans currently not covered. Why would we not want to do that? Why would we not want to negotiate that? And that's my only reason for the amendment. We've tried this in the past with this Amendment 25, better known as Insure Tennessee, which was actually based on the governor, former Governor Haslam, going to Washington, D.C., negotiating with that administration, coming back with an agreement, which pretty much was a block grant. But unfortunately, we were not able to pass that bill, the Insure bill. And the other thing, my amendment simply says again that whatever is negotiated by this amendment must come back before this General Assembly for approval. So with that, Mr. Sponsor and Mr. Chairman, I encourage you not to vote against tabling this motion.
Thank you, Representative Miller. Okay, now we're voting on the table of motion. All in favor, aye. Opposed, no.
No.
Amendment will be tabled. Now we have a motion. We have an amendment 005212. Representative Hodges, you are recognized, sir.
Thank you, Mr. Chairman. This
We have a motion properly second.
This amendment's pretty simple. It's just about protecting our elderly. If this bill passes in its current form, there are no assurances that our elderly will continue to receive the same coverage for nursing home care. And currently, between 60 and 65% of nursing home residents in Tennessee are Medicaid recipients. So, really, I just want the amendment to protect, the most vulnerable people in our community.
Thank you, sir. Chairman Hill, you recognize, sir.
Thank you, Chairman Travis. What is being brought forward here is, I think, is a genuine concern by the sponsor. But the bill that is as written does not preclude or prevent there being protections negotiated out in the block grant process. It doesn't. The bill as written with the original intent does not prevent any of this from being negotiated in the appropriate order in the appropriate time. And so, Mr. Chairman, I move Amendment 5212 to the table.
Chairman Hill has made a motion to lay it on the table. We have a second. Cuts off all the debate except for the sponsor of the amendment. Representative Hodges, you're recognized, sir.
Thank you, Mr. Chairman, and thank you for your response. I do get what you're saying. I think it doesn't guarantee that our elderly will be protected either, and I think guaranteeing that we protect our elderly is never a bad thing. With that, I just ask you not to table my amendment. Thank you.
Thank you, Representative. Now we are voting on tabling motion 5212. All in favor of tabling the motion, say aye. Opposed, no. Motion is tabled. Now we're back on Amendment 1. code number 4786. Chairman Hill, you are recognized, sir.
Thank you, Chairman Travis. This is the
We have a motion and second on the amendment.
amendment that rewrites the bill that came through the subcommittee. And it rewrites the legislation, requests a block grant, and also has whatever, if it's possible to have something negotiated out with the feds, has to come before the legislature for approval prior to implementation.
We have any discussion on the amendment? Yes, sir. Representative Miller.
Thank you, Mr. Chairman. Mr. Sponsor, in the amendment, what is the amount of funds that we're requesting?
It is not a specific request as far as a specific dollar amount.
But at least under our current appropriation federal dollars, at least we're asking for that amount, or we're not.
What the legislation does is it sets out legislative support and requirement for the request to be made for block grants.
For an example, currently we're getting what, maybe $7 billion, or what percentage of TennCare funding are we getting now?
I think it's closer to 7.5.
Okay, 7.5. So in the amendment, we're at least negotiating for 7.5 billion.
What the legislation does is it requires the request to be made. I'm confident that the governor, through the commissioner of F&A, is not going to accept a proposal that's less than what we get now.
Correct.
Correct.
Well, okay, that answered that question. I would hope not, but again, in the amendment, your amendment, it doesn't specifically say that we want to negotiate above what we're currently receiving from the federal government. It doesn't say that.
Correct.
Would you be open to an amendment for that at some point? Okay. All right. Thank you.
Thank you,
Mr.
Representative
Chairman.
Miller.
Thanks, Sponsor.
Representative Jurgen.
Thank you, Chairman. Chairman, I have a couple of questions, I guess, about block grants.
And we're on the amendment?
Oh, well, the amendment makes the bill?
Yes, sir.
So, okay, right, yeah. So, the block grant that we'll be negotiating, because I can't find that where it's currently legal for block grants in the federal government. Are you trying to amend our state plan, the 1115 waiver, in order to get the block grants? Is that what we're doing?
The intent of the legislation is as simple as it appears, which is initiating the request. Where that follows suit from there is really up to the governor and the commissioner of F&A and CMS on the federal side.
Okay, so, Mr. Chairman.
Representative Jurgen.
Yeah. So if we were granted a block grant, that's a lump sum of money to us, correct? So if we were fall into a recession, we can't go back to the CMS to get more money. Will we get to use state dollars at that point to make it up?
I think that the concern that you're bringing is a classic concern and a valid concern. And the hope the thought is as the governor carries forward with this request that the legislature is putting forward, that will be part of the discussion. It has to be. The thought process behind a singular block grant is good, but there's no less than 500, 1,000, maybe more, or thousands points of negotiation, and that's something that we anticipate would be mentioned, because that is a concern. But that's addressed in the negotiation section.
Okay, one more question, Mr. Chairman.
Chairman Jurgen.
Thank you. So when we negotiate and say they grant some block grants, the way that I've seen the block grants before, that they use, the most recent data they use is 2-year-old data. So what concerns me is if we use 2-year-old data, and so last year we expanded the waiver for intellectual disabilities. We're about to do, hopefully we'll do Katie Beckett. that will not be part of the data from 2 years ago. So if it's, example, $100 a person, and we don't have the data for new programs that we use, will we fall short of money because we just won't be able to cover everything we've passed in the past 2 years?
And Chairman, I think that, again, I think that's a valid concern, and that's part of what this process meets. And so if the request is made and negotiations begin, or as they begin, we're hopeful that they will, but as they begin, these concerns have to be raised and they must be addressed. And as it comes back before the legislature for approval, and those are many steps to get to that point. The thought process is that it would be addressed prior to coming back to us for approval.
So these questions probably be appropriate for that time when it comes back.
Well,
I guess.
Yeah, yes and no, but I think that they're valid right now because when we're going through the process of passing legislation, we're talking about legislative intent, and as this request moves forward, we definitely want to be able to look at it from all sides and to be able to come forward with the best product. That's the reason that this amendment and ultimately the legislation is as bland as dry wheat toast, as it were. It is literally that bland, but it's on purpose because we want to try to get the best product that we can if it's possible.
Mr. Chairman, hope we get some jelly on that toast. I appreciate your patience.
Representative Thompson.
Thank you, Mr. Chairman. I had actually some questions similar to Representative Jernigan's, but I think I can ask a few variations of that I'm really interested in. So as I understand the block grant process, you'll be negotiating with, or the state will be negotiating with the federal government to determine what kind of a deal we can get. This being the first block grant ever in any state. So a lot of the fears and a lot of the objections to block grants come from the inflexibility of the revenue source. I mean, we get this big block grant of $7.5 billion, or maybe even $8 billion. I don't know. We're right now we've exceeded the time period of economic growth, and we're due for a downturn. And I think realistically, historically, it's going to come, and it'll probably come in the not too distant future. So when that downturn comes, revenues reduce, then is there a possibility in that negotiation process that it would be negotiated that we would reduce, the state would have the flexibility of cutting services as a result of lack of funds? Is that a possibility of something coming up?
Chairman,
Yes,
like it was done
Chairman.
in 2005 by Governor Bredesen. Is that what you're referring to?
Possibly.
Okay. Again, it is very important for us and Representative to try to answer that question because it's a valid concern. There are models out there that deal with indexing, models that deal with to try to approach those concerns. That all should be brought forward after the initial request is made and we see that there's an opportunity for negotiation. But it is certainly something that should be at the table because it has to be a concern with any program that's tax dollar funded.
Representative Thompson.
Okay, so in other words, there's that possibility that based on the state's agreed negotiation with the federal government that we would cut certain recipients from this, that we could either reduce or cut prescription drugs from the whole plan, that other types of cuts as well.
Chairman Hill.
Thank you, Chairman. Again, I'm concerned about the politicization of this type of process. You're asking me to take out a crystal ball and say, well, this is what's going to happen, so therefore that's what has to happen. That's not the intent of this legislation. What this legislation does is it makes the request, it requires the request. Where it goes from there, we'll have to see. But all the concerns, which are valid, brought up by other representatives, folks that are here today and watching this, they are valid concerns, and they can be addressed through the negotiation process. But for me to stand here and guarantee an outcome is not realistic. And also for members to be concerned that it's a required that there'll be cuts or that there'll be this, that's nothing more than fear mongering. And I'm concerned when that's brought forward.
Chairman Sparks, you're recognized, sir.
Chairman, I just want to thank you for bringing the piece of legislation and all the discussion I heard, whether it was the former members with the amendments. I want to thank them. They all have sincere interest. But I know when I was, talking to several thousand people in the district, healthcare was one of the big issues in my community, probably the biggest. My heart goes out to you rural guys that have had some of these difficulties. I've got two great hospitals, Stonecrest Medical Center, St. Thomas. But even President Trump addressed health care, and he's done some great things. I mean, lifting the gag order, I think, was one. But there's, we've really got to work on this issue. I mean, all of us together in a bipartisan effort. And I don't want to rant and rave about anything, but I get very frustrated when, I got a myriad of lobbyists coming up to the office. No one's ever advocated for lower drug prices. No one's ever advocated for affordable health care. Not one lobbyist has ever come by the office to do that. I've got a sister that's in a nursing home, don't even know who I am half the time. We're caring for an 88-year-old mother. People are living longer. We're facing a crisis. And sometimes I feel like I'm the only one that's seeing this stuff in my community. But I just want to thank you, and I want to thank the governor for his awesome speech last night for trying to address some of these issues. Thank you, Chairman.
Thank you, Chairman Sparks.
Call for question, Mr. Chairman.
Our question's being called for on Amendment 4786. Without objection, we are voting on Amendment 4786. All in favor say aye.
Aye.
Opposed, no.
No.
Ayes have it. Amendment goes on. Now we're back on the bill as amended. Questions on the bill? Without objection to the question, we're voting on House Bill 1280. All in favor say aye.
Aye.
All opposed, no. No. Ayes have it. Bill goes out to Finance, Ways, and Means. Thank you, Mr. Chairman. Well, I believe that concludes today's Insurance Committee. Appreciate you guys' time, and with that, we're adjourned.